All right, so how I'm going to do this is I'm going to pretend that I'm following along with the PowerPoint. So if you want to just pull it up while I'm doing this, I'm going along with it, and you can go along with it as well. So starting with the title page, my topic was on restraint and seclusion in ABA. So on the second slide, I just wanted to first touch on the definitions of restraint and seclusion, but it's important that we know that the use of restraint and seclusion in ABA has been an ethical debate for many years. There's a lot of ethical and legal issues that arise when discussing this topic. The use of these extreme tactics have been used to treat behavior problems since the 18th century. Many have fought to get rid of the complete use of seclusion and restraint, but this battle is something that is still going on to this day. So first, a basic restraint involves physically holding or securing the individual either A, for a brief period of time to interrupt and intervene with severe problem behavior, or B, for an extended period of time using mechanical devices to prevent otherwise uncontrollable problem behavior, for example, self-injurious behavior, and that has the potential to produce serious injury or endanger of others. The definition of seclusion involves isolating an individual from others to interrupt and intervene with problem behavior that places the individual or others at risk of harm. All right, I will go ahead and move to the third slide. So this is just kind of like the brief history. I did want to talk about the history of restraint and seclusion. The use of restraint and seclusion, like I said a couple of minutes ago, it has been used since the 18th century as a behavioral medicine technique to control behavior. I kind of wanted to discuss about Britain and kind of like their sense on it. But back in the day, restraint and seclusion could look like being locked in unclean rooms with no light, to sometimes even being held in manacles, like the metal things around your wrist. There was definitely more extreme cases back in the day, which luckily it has proceeded and gotten better over the years. But about 170 years ago, Dr. Robert Hill, he was probably one of the first people who did a lot of research and experiments with like the no restraint movement. And many clinicians since then have attempted to end this, like the use of restraint and seclusion. So I wanted to make note about Dr. John Connolly. He actually is the one who proposed the non-restraint movement in Britain. It started with the Middlesex County Asylum, and he was actually able to reduce the use of restraints from 800 patients to none in about 3 months. And then all of Britain and kind of Europe took over in England, the opposition of, using no restraints. Since then, though, the U.S. has always been a divided topic, like I said, and they actually ended up opposing the no restraint policy in about the late 1800s, and ever since then, it's been this big ethical debate that is still going on to this day. So going on to the fourth slide, I did kind of just want to show pictures of kind of what they used to look like in regards to restraint and seclusion. So first, seclusion rooms. So in the past, like I said, they were rooms with like no light, no anything, and patients could spend many days in there. So it's pretty sad. I did a lot of research on like videos and other pictures about stuff like that, and there's some horror stories. And then the other kind of rooms are more present rooms. I did kind of want to make note that the top middle one is kind of one like a psychiatric hospital would have. I know this is ABA, but seclusion is used a lot in psych hospitals, and so I did want to include that. But down there and below, that is a picture of a seclusion room in a school setting where a lot of kids will end up being put. You can see it's kind of similar, a little padded room and things like that. Going on to the fifth slide. These are examples of restraint. So like I said, those manacles, that's the past. Thank God we don't use those anymore. So these are your more typical restraints that you will see in present day, a little more padded and things like that. Those are considered the mechanical restraints. All right, number 6, the use of restraint and seclusion rarely ever causes harm, but there's also a handful of horror stories which just goes to prove how dangerous this method of behavior reduction can be. So I did want to give an example. So on the 7th slide, you will see my example. So Cedric Napoleon, a 14-year-old special education student, died March 7th, 2002, after a teacher and a classroom aide restrained him in Texas. He suffocated due to pressure on his chest. The school said he was disruptive. His foster parents said that when the restraint happened, their son was attempting to leave the classroom to look for food because school officials had limited his food ration as a punishment. The boy was not fighting or involved in any violent act at the time of the restraint. This is from the Associated Press. So that is just one example of horror stories. There is actually, I found multiple, which again is pretty sad. And yeah, like I said, it rarely ever causes too much harm, but there is a handful of cases where it has even caused death. So before I kind of talk more, I did want to share the ABAI position statement on the use of restraint and seclusion. I think that's really important for all of us as aspiring BCBAs to know, just so we do know kind of what they kind of look for in regards to that. So the ABI position statement says the Association for Behavior Analysis International and its members strongly oppose the inappropriate or unnecessary use of seclusion, restraint, or other intrusive interventions. Although many persons with severe behavior problems can be effectively treated without the use of any restrictive interventions, restraint may be necessary on some rare occasions with meticulous clinical oversight and controls. In addition, a carefully planned and monitored use of timeout from reinforcement can be acceptable under restricted circumstances. Seclusion is sometimes necessary or needed, but behavior analysts would support only the most highly monitored and ethical practices associated with such use to be detailed below. And then they go into like more detailed about when to use them. So I definitely want to highlight a lot of that in my presentation. It's important to know when we can and can't use restraint and seclusion. It's important because we do want to do our best practice, and we always have to rely on our professional judgment on when to use these intrusive interventions. Moving on to my 9th slide, I did put the ABA guiding principles. So those are just kind of 3 basic guiding principles that I think actually detail and kind of lay out a lot of good things that we as aspiring BCBA should follow. So the first one is the welfare of the individual served is the highest priority. Number 2, individuals and parents or guardians have a right to choose whether they want to use restraint and seclusion. And 3, the principle of least restrictiveness. So we all know that we want to use the least restrictive intervention possible. So to find the purpose of kind of when to use restraint and seclusion as a behavior intervention becomes difficult, and that is mostly used as a punishment procedure, but there are many other ways to use these depending on the client and obviously the situation. I know, for example, seclusion and timeout, can just be trying to remove a student from a setting and place them in a room, so it could just make them feel better and kind of calm them down. During this time, one would hope that the individual would engage in problem-solving processes and is ready to kind of return to their regular environment, but they don't always go as smooth as that. So I did kind of want to highlight when we should use these kind of interventions. So slide 10. So when should you use seclusion in a behavior management intervention? I kind of first wanted to highlight the difference between timeout versus seclusion. More often than not, we actually would use timeout more than we would use the term seclusion. And I'll break that down into my next slide. But the purpose of timeout in a school setting is to prevent a student from accessing positive reinforcement in order to decrease a certain inappropriate behavior. Because the goal of this strategy is to reduce the occurrence of a specific behavior, timeout is known as a punishment. So going on to my next slide, slide 11, I wanted to kind of break down the levels of timeout that we can use as a behavior modification. So there are 3 different types of timeout uses. The first one is inclusionary. So that's meaning that the student is often ignored and move the student in the environment. So they're kind of still in the environment. And so the student is still able to see and hear what is happening in the classroom. The second one is exclusionary. So exclusionary means the student is removed from the current environment, but still has access to another environment with staff and students. So they're still able to get the same things that they would be getting, but they're just changing the whole environment in of itself. The third type is called seclusionary, which means the student is sent to a location outside of the environment where they are left alone with no access to reinforcement and no access to other staff, students, and other materials like that. Now this is kind of when seclusion differs. So those are the 3 types of timeouts. And then we go to our last and final kind of top level, and that's the seclusion. The next level after that, of course, is the seclusion, which means a child is physically unable to leave the room. So timeout in rare cases, seclusions, are used for the same reasons, but a behavior intervention plan that incorporates the use of timeout, we need to make sure that we have behavioral assessment, incorporate reinforcement strategies. We want to make sure we're evaluating the objective, data, and obviously be consistent with the scientific literature and the current best practices using timeout and seclusion. So going into our next one, slide 12. So when should you use restraint as a behavior management intervention? So using restraint as a behavior intervention plan alongside other interventions is to help reduce or eliminate the probability of a targeted behavior and reduce the severity of that behavior. So I just want to give some examples of problem behavior that most of the time restraint is used for. So self-injurious behavior, so for example, hitting, biting, head banging, scratching, etc. Next one would be aggression towards others, destructive behavior to the environment, to the setting. It could be screaming, and I also found examples of pica, so eating inedible objects could also be something that someone maybe would use a restraint for. It's good to know that using restraint as a behavior intervention plan is used alongside other interventions to help reduce, the probability of that targeted behavior. We want to make sure again that, restraints incorporate reinforcement-based procedures. They're based on the functional behavior assessment. They're to be evaluated by the objective outcome data as well as seclusion is, and be consistent with the scientific literature and current best practices as well. These are all stated by the ABAI. My slide 13 is the 2 different types of restraint, so I kind of want to talk about that really quick. So a physical restraint is a restraint that immobilizes or reduces the ability of a student to move his or her torso, arms, legs, or head freely. So more importantly, that's when basically another human being is basically restraining another human being. And then when it comes to using different types of materials, that's where we go to mechanical. So mechanical restraint is similar, as its goal is to reduce physical movement, but instead of using your own self as a physical restraint, you use a device or equipment. So this could be vests, straps, belts, limbs, ties, hand mitts, wheelchair, bars, brakes, chairs that tip backwards, bed rails. A lot of those are more used in psychiatric hospital settings, but those are just many examples of what a mechanical restraint would look like. Moving on to my 14th slide, I'm going to talk about the ethical issues with using restraint and seclusion. I found a great article that just kind of broke down 6 ethical issues that people have with restraint and seclusion, so I just kind of wanted to list those really fast. So the first one is obvious potential for death and injury. Like I said, that's a rare case, but like my example I gave earlier, it can definitely happen. Number 2, failure to use the least restrictive intervention. We all know that that's one of our guiding principles, is to make sure we're using least restrictive, and if you are jumping to these, sometimes it could be a failure of that one. Number 3, removal from access to education. So in regards to timeout and seclusion, we can be taking students away from their access to education, which is actually one of their rights. So we can be taking away rights from our students. Number 4, repeated use of potentially dangerous interventions. So if we use it once, okay, but if we continue to use these dangerous interventions, there could be some harm to that. Number 5, disproportionate use with certain critical groups. So there has been kind of proven facts that sometimes in regards to certain cultures, more cultures are being have used restraint and seclusion more than others, which again, that is absolutely not right, but there has been some stats with that as well. So for example, I just wanted to find this, in a sample of 38,792 students with disabilities comprised 12% of the reporting sample. Of those students who were restrained, 69% were students with disabilities. In another part of the survey, just over half the population were white, 24% were Hispanic, 18% were African American. However, 42% of students in that sample who had been secluded were Hispanic. Mechanical restraints were also disproportionately applied to minority students. African American students comprised 21% of the sample, yet 44% of the population who had been subjected to mechanical restraints. So those are some pretty crazy numbers if we think about it. So that's something that we as ethical professionals need to be aware of. All right, so back to number 5. That was number 5. Number 6, insufficient training and supervision. So the use of restraint and seclusion, it takes training, it takes supervision, and a lot of the times we could lack that as BCBAs, or maybe our coworkers could too. So it's always important to kind of keep track and know that we are being competent BCBAs. All right, going into my 15th slide. Now this goes into the professional ethical compliance code for behavior analysts. So I found a couple codes that I think definitely line up with this topic. The first one is Code 4.0, Behavior Analyst and the Behavior Change Program. So it's more specifically 4.08, Considerations Regarding Punishment Procedures. I actually took A, B, C, and D from this one because I think they all pretty much line up. It is so important for us as BCBAs to consider, the punishment procedures and all part about that. So behavior analysts recommend reinforcement rather than punishment whenever possible. If punishment procedures are necessary, behavior analysts always include reinforcement procedures for alternative behavior. Before implementing punishment-based procedures, behavior analysts ensure that appropriate steps have been taken to implement reinforcement-based procedures. And then D, behavior analysts ensure the aversive procedures are accompanied by an increased level of training, supervision, and oversight. Very important. All right, my 16th slide is 2 more codes from Code 4.0. The first one is 4.09, least restrictive procedure. Just like I mentioned earlier, one of the ABAI's guiding principles is using always the least restrictive procedure. So we need to make sure that we review and appraise the restrictiveness of the procedures and always recommend the least restrictive before anything else is likely to be effective. 4.10, avoiding harmful reinforcers. So behavior analysts minimize the use of items as potentially reinforcers that may be harmful to the health and development of the client. So just like I kind of said that article listed, it is quite possible that repeated use of these dangerous procedures can be harmful to our clients, and we need to be aware of that. Going into my 17th slide, I thought this code is very important. It's code 7.0, Behavior Analyst Ethical Responsibility to Colleagues. I feel like this is very important, most importantly 7.02, because we do have the responsibility to check ourselves and check others. So ethical violations by others and risk of harm. So if we do see a colleague, abusing the power of using restraint and seclusion, we as ethical and professional BCBAs should know when to report and when to kind of be aware of if we see our colleagues abusing these types of restrictions and interventions. And it's important to kind of know the appropriate way to do that and how to address the matter. My last slide, I just kind of want to end on this note. The bottom line is we should always use least restrictive procedure and exhaust any other intervention before we go to restraint and seclusion. The main goal of using restraint and seclusion is to control the behavior of a client in an emergency situation. An emergency situation is considered when there is immediate danger and the client could potentially harm themselves or other. I found this quote, and I think it's really important to know this. As of right now, there is no federal legislation regarding the use of restraint and seclusion procedures in school to date. With that being said, it's very difficult to determine and define emergency situations in which it is acceptable to use this intervention. So the bottom line is we have to use our best judgment on when to use restraint and seclusion. And with our guiding principles and with our ethical code, we should be able to make the best and most ethical decisions on when to use these potentially dangerous interventions. And my 19th slide is the end. And then my 20th slide is my references. Thank you so much, and I really, really appreciate you letting me do this. I'm still not feeling 110%, so took a lot and I appreciate it. Thank you so much and have a happy holiday.